Hey, I'm Tamara Kendacker, and you're listening to the Decibel from the Globe and Mail. Before we get into the show, just a warning that there are some graphic details in this episode that may be disturbing to some listeners. So during the first wave of the pandemic, one of the biggest stories in the news was the carnage inside long-term care homes. Seniors were among the most vulnerable groups to COVID-19, and before the vaccine, thousands of them died in outbreaks in facilities across the country. And what made the situation more devastating were the horrific details coming out about how these residents were treated and the feeling that this was largely preventable. Over the last several months, a coroner's inquest headed up by Jihan Kamel has been looking into exactly what happened at 7 long-term care homes in Quebec, where things got so bad that the military was called in for help.
I had been interviewing healthcare workers, and I remember one of them telling me the feeling of having somebody hold your hands and saying, "I'm dying," and having her last breath in front of her. So you can imagine that kind of trauma that these people had.
My colleague Tu Thanh Ha has been following the inquest, and he's on the show to talk about the testimony he heard and about what needs to change to prevent this from ever happening again. You're listening to The Decibel. Ha, hello. Thank you so much for coming on the show. Really, really glad to talk to you.
Thank you for inviting me.
So you've been covering the inquest in Quebec on what happened in long-term care homes since the start of the pandemic. For many weeks now, you've listened to a lot of testimony from officials and staff and families of people who were in the homes. What are some of the stories that stuck with you?
I think there's this one story which exemplified the entire squalid, absurd situation that the people found themselves in these first weeks of a pandemic. A couple together in sharing a room at the Herron nursing home. The wife dies. The husband, who has Alzheimer's, doesn't quite grasp that she is deceased. And so every few hours, he keeps rediscovering her. And we believe that it is also the same couple who are described in another testimony as being very difficult to remove the body because he was still clinging to his wife, and it took several nurses to handle that. So he was left in that room for 24 hours with her.
Oh my God, that is horrific.
In another assisted living facility, a private one called the Manoir Liverpool, a man had choked. He became agitated, and the orderlies who were not familiar with him were afraid of him. So instead of assisting him, they stayed back instead of giving him the Heimlich. And then when he fell unconscious, in their panic, in their poor training, they tried to give him CPR, but they did it with his body still half on the bed, so there was no support underneath him. And I think of other families who came to this inquest and never learned the full story, like they were hoping to have an answer. And for example, I'm thinking of the family of Mr. Léon Barrette. He was admitted the same day that the COVID-19 outbreak started at the Herron nursing home in Montreal. And so on his medical chart, there are indications that he was admitted. He needed oxygen, but there's no indication that anybody looked after him or did anything until a few days later when he was found dead. So the family is afraid that he was simply forgotten in the chaos that descended on that nursing home, and that he was just left to die without proper attention in his room. And they'll never know the answer because the evidence, the testimonies that we have heard have not managed to circumscribe what exactly happened.
We know that more than 4,000 people died at these homes, but not all of them were from COVID, right? Some of them died from things like starvation, dehydration. Did we learn from the inquest what that breakdown is?
No, and let me underline that they didn't die directly from COVID. And I'm very careful because I've seen some people seized on this fact as proof that COVID-19 was not a big issue. But we it seems from all the testimonies we have heard, from all the evidence we have heard, that a number of people died because they were neglected amid all the confusion that it was created. And if COVID-19 had not created that chaos, that confusion, these people might have had better care and might still be alive.
Yeah.
So as with like all these catastrophes, there's not like a single cause for this, but like it's a cascading series of failures.
So I remember hearing a lot of really awful stories coming out of these homes on the news while it was happening. And, you know, there have been inquiries that have looked into the crisis in long-term care in the past. But why do you think this one in particular is worth talking about?
It's true that this issue has come up before, like our inability to provide adequate care and adequate lodging for elderly people. But the circumstances here are different. First, the scale. We've never had so many fatalities before. The circumstances were like in really squalid, gruesome conditions. And the public discourse has already moved on. We're all talking about vaccines. We're all talking about recovery and return to work, return to school. And I couldn't just let go of the fact that thousands of people died in terrible circumstances. And that's the reason why I just kept attending, listening to the testimonies, listening to the hearings. This coroner's inquest in Quebec is also exceptional because it's the only one holding public hearings. Ontario did have a commission looking at long-term care homes during the pandemic, but it did not hold public hearings. And so in Quebec, not only did you have public hearings, so it brings like a level of immediacy, a level of scrutiny that you didn't have before, but also the format to where they went home after home, and we went in a detailed fashion over what happened with each home. And because each home was also geographically located in different parts of Quebec, it also drew a lot of attention from the local media. So in terms of impact on the public consciousness, the public awareness of what has happened, I don't think we have seen that exercise elsewhere in Canada.
And what is the goal of the inquest?
The mandate of a coroner is to come up with recommendations to make sure that these tragedies don't happen again. So the coroner will not find criminal or civil responsibility, but there will be some recommendations as to how governments could try to do things in a different way to prevent this from happening again. Okay. But I think in this case, it's not so much the report itself, but the exercise that has forced people to just go back over what happened and see if there are any lessons to be drawn.
A lot of people, I imagine, are traumatized by what happened. A lot of the people who testified, and it hasn't been that long. So what was your impression of the mental state of the people who gave testimony?
I was very struck by the number of people who were in tears during the testimony. Some of them, they were in tears because they were grieving. There were people who also were in a traumatic state because they did not expect to be parachuted into these conditions. Let's remember that at one point there were a large number of nursing home workers who were missing because they had been exposed to the virus or because they didn't want to show up for work out of concerns anymore. So other people had to be sent in. So they would be hospital workers, like therapists, physiotherapists, occupational therapists. They could be pharmacists. It could be people who work in community clinics, and they were all parachuted to help, as a SWAT team. And they go in there. It's an environment that already they're not familiar with, and they go in and they see emaciated people lying in dried urine and feces and dried vomit. They see people who are dying. Even before the inquest, I had been interviewing healthcare workers, and I remember one of them telling me the feeling of having somebody hold your hands and saying, "I'm dying," and having her last breath in front of her. So you can imagine that kind of trauma that these people had. And there was also another form of trauma is people who kind of had a form of amnesia. They were confronted in the evidence, in the testimony, with the fact that they could have done things differently. They could have shown up for work, or they could have made a different decision. And as a result, people died. And these people, when asked about it, they said like they didn't remember. And I think either they're in denial or simply they could not confront that and talk freely about it.
So you think they've sort of like blocked it out of their minds, maybe?
Yes, it's quite possible. So it was like an extremely emotional exercise.
Yeah. What did you learn from the inquest about what it was like to work and live inside these homes and how residents in long-term care were treated before the pandemic?
Yeah. Well, okay. We always knew that the healthcare system is not financed properly. But things that I didn't fully grasp, first of all, is that I think like the people who got like the shortest hand among the short hands were people in nursing homes. It's an awkward financing model to start with because it's kind of partly financed by people co-payments and it's partly financed by the government. So when you live in a nursing home, you pay rent. These are homes that are not properly staffed. They're not properly equipped. And it's a very fragile situation. They're barely hanging in. And then the pandemic happens and it just like pushed it beyond their capacity to handle this. In Quebec, most of the homes are public, but nevertheless, they're not properly financed. And so there's a long waiting list. And most of the facilities are also in aging buildings. They're not like the ventilation is not good. And they're all full, which when the pandemic struck, also created a huge headache because if there's an infectious disease and you're trying to isolate people who have been contaminated, who have been infected, how do you do that if all the beds are taken? It's like a Rubik's Cube, like every time you move something, something else has to move. Mm-hmm. So it's much harder to implement measures to prevent and control infections in such a place.
So I guess like once COVID hit, the way that these homes are set up makes it very hard to control the spread of the disease. And then what kind of decisions was the government making that made things worse?
So in the weeks before COVID first appeared in Canada, you'll remember that the virus had struck hard in Italy. The news from Italy was that emergency rooms, intensive care units were overwhelmed. So therefore, it was the priority for the government. We have to protect hospitals. Mm-hmm. How did they do that? First, they discharged people who didn't need acute care immediately. They were discharged, some of them to nursing homes. And also, in nursing homes, the government made it harder for people to be transferred back to hospitals. They issued directives that if somebody is found with COVID-19, they cannot be transferred to hospital without a doctor's authorization. On top of that, the personal protective equipment was rationed, and the priority was also for hospitals, so that nursing homes were also discouraged from using them as much as possible in the initial phases. So staffers were told not to wear masks unless they came close to somebody who was showing symptoms. And we now know that people can get the virus before they show symptoms. There was a doctor who testified who said that she wore a mask when she went grocery shopping, but well before she wore a mask while she was treating patients.
Wow.
And lastly, there was a lockdown in mid-March at all those homes, the idea being that, to prevent the spread of a virus. But because there was a lack of staff, a lot of time families visiting provided like those extra eyes, those extra pair of hands to help, and now they were no longer around.
Right.
And so you have thousands of elderly people left in this home. Their families don't know what is happening with them. They call and nobody is answering the phone. Or sometimes the elderly resident has a cell phone and manages to call the family and tells them, I have been left alone. Nobody is answering my call bell. I have not been fed. Please do something. And there is nothing they can do because nobody is answering. And meanwhile, there's inadequate staffing so that there's like the food is not served. People are not hydrated. They're just lying there and gradually dying.
Wow. And then we also heard about how so many of the staff at Herron disappeared. So what happened there?
This is something that the inquest wants to revisit. because the owners of Herron said that one of the reasons that a lot of the staff disappeared was because they were told by authorities, if you've been in contact with somebody who tested positive, then you have to isolate for 14 days. Other testimonies we've heard said that some of them panicked and simply said they were not going to show up anymore because they had concerns. Herron at the time did not have a director of nursing care. It had been without a director of nursing care for 3 months. So it was a home where like the managerial tier was very slim and didn't have medical expertise, medical knowledge. So it was very vulnerable, and it could not provide like the leadership that could have braced up the employees and reassured them and provided them with measures to reassure them that they would not get sick. So eventually the authorities got wind that there was a huge problem at Herron. They show up and they find only like a small handful of employees left to look after 139 residents.
And what was that like for them, those employees who were left?
One of them who remained described this gruesome experience where she worked something like 18 hours trying to just like constantly running from one room to another, trying to dispense medication, trying to clean up people, and just having no sense how it would end. Mm-hmm. And you can sense from her testimony, like there's a certain level of resentment of the people who left too.
What did you learn about the differences between private and public care homes and their handling of the crisis?
Well, the thing that struck me with private homes is that you're paying for care that may not be very good. Like some families said that, they decided to move their parent to Herron because it looked like a place where people were engaged, like there was a sense of community, that it looked really well taken care of. And then things started declining in about a few months before the pandemic because there had been some labor troubles, there had been a change in management, and people were not replaced. These things can change very quickly. And suddenly, they're trapped there. And they were paying $3,000, $5,000 a month for this. So it was nearly unanimous of the 4 families that spoke to the inquest, 4 families of deceased people who spoke at the inquest. They said the private sector has no business dealing with elderly people. They're just too vulnerable to leave it to a for-profit organization.
So where does this inquest go from here?
So at the end of October, we will have 3 more days looking at Herron because the coroner would like to know more about exactly what happened in those hours when the staff left. The coroner Jehan Kamel wants to know whether people left in mid-shift or whether it's still murky. Mm-hmm. And after that, in November, we will have hearings that will look at the province-wide, the Quebec-wide directives and policies, the policies such as putting a priority on hospitals, the failure to act on asymptomatic transmission. Mm-hmm. So it will be a bit more dry, but it's really those policies that set the stage for what has happened.
Just based on what you've heard so far, what do you think might be some of the recommendations for changing the system moving forward that come out of this? One of the questions that the coroner Kamel kept bringing up was the example of one facility in Montreal, the Montreal Chinese Hospital, which despite its name is not a hospital, but is a long-term care facility. And the staff there, at their own initiative, all started wearing masks all the time, early on, before they were told to do that. They had 0 fatalities. And it was very striking because in a lot of other cases, the line of defense or the excuse that people kept bringing up was we were following the government directives. We were following the directives of the National Institute for Public Health. Doctors saying, well, I didn't show up because that was the recommendation of my professional federation. Mm-hmm. So there is something to be said about people who are willing to be more careful, to take more actions and go beyond the strict minimum that was set out by the directive, especially since these are places that already have trouble meeting the minimum. Okay, well, thank you so much for staying on top of it, and thank you for this conversation. I really appreciate it. You're welcome. All right, that's it for today. I'm Tamara Kandaker. Our producers are Madeline White, Cheryl Sutherland, and Kasia Mihailovich. David Crosby edits the show. Angela Pacenza is our executive editor. Thank you so much to Tu Thanh Ha. You can find him on Twitter at TUTHANHHA. If you want to reach us, you can email us at thedecibel@globeandmail.com. If you want to reach me, I'm on Twitter at Anima_TK. Thank you so much for listening, and I'll talk to you next week.